Hi, I'm Elizabeth Goacher. I'm a physician assistant at Duke University Medical Center. I'm glad to be here to talk with you about the question that's been put in front of me. If you deem your patient a non-responder to standard therapy with ursodiol, what is your approach? That's a great question, and I'm so glad that it's been put out there and that we're going to be paying attention to it because it's really important as we move forward in the field and we have new things coming. What do you do? Now we have something to do, right? So with ursodiol, assuming of course you've decided they're truly a non-responder by making sure that you've got those serial labs over time, looking at dose. Moving on from there, what do we do? You have options. Looking at obeticholic acid is certainly one of them. You're going to need to look at the patient to see if they're a good fit for obeticholic acid. If they're already somebody that's an itchy person, maybe this is not the right thing, but having that patient engaged discussion about a possible change, possible add-on to that therapy is very reasonable. And some people do great with it and some people don't. And if they respond great, you've got your add-on therapy there. The next thing we do think about, if you have any availability, is clinical trials. Since this is such an orphan illness and doesn't have a whole lot of people in it, it's really important that we engage them in clinical trial work wherever possible. So going to clinicaltrials.gov, if that's something that you are familiar with or your patient may even be familiar with, looking up the closest available clinical trial site to find some way that we can engage these patients in clinical trials so that we really can get good solid evidence on what the next best step in therapy is. AASLD endorses and so does EASL the use of consideration of fibrates. In the EU they have this approved, whereas in the US we don't. But looking at fibrates as an add-on therapy for the right patient population is something to consider. It's also exciting that we hear some things coming down the pipe that maybe in the next few years we're going to have something else. But looking for the future and hoping for the best is really important for this patient population. It's great to be thinking about something at least to add on to ursodiol.